And our next ick factor is one that can cause quite a bit of pain, and it isn't very pretty. I'm talking about pilonidal cysts. And join us via Polycom to talk about what she calls her own little buddy is Jody from Tarpon Springs, Florida. So, Jody, first things first, how long have you had your quote-unquote little buddy?
Since puberty.
How is it acting up right now?
Currently it's sleeping, and I work really hard to keep it that way.
So do you ever do anything to baby it?
All the time. The list is long. A few of them are the blue jeans that I wear. I never flop down on any piece of furniture. The car that I buy. Auditorium seats, I have to make adjustments for that. And probably the biggest offender that's caused me the most grief are the handrails inside of elevators. I now stand my ground in the center.
That's a great point. So here to help us explain the various treatments for pilonidal cysts is colorectal surgeon Dr. Mari Madsen from Cedars-Sinai Medical Center. Welcome to the show.
Thank you.
Let's explain what a pilonidal cyst is.
It's literally hair that has been, it's not actually an ingrown hair, but it's hair that has been pushed back into the gluteal cleft, and it gets forced underneath the skin, and as more and more hair nests underneath the skin, eventually it forms a cyst, which potentially gets infected.
As you can see there, sitting in certain positions, leaning up against a railing can cause a significant amount of pain. A lot of different options, and some not as pleasant as others.
Certainly. Most of the time when people come to a physician for the first time with this issue, it's because it's become infected or abscessed. And so it will become acutely painful. If it's allowed to progress for long enough, people will notice pus or blood coming from that area. And oftentimes it may need to be drained in the acute setting. And that would usually be the first round of treatment if someone were to come in with an abscess.
And those abscesses can get really big. And speaking of, an ick factor, just to be honest on the show, draining a pilonidal cyst is right up there with...
It's up there.
It's the ick factor.
Probably one of the worst things I have to do.
It's unpleasant, the stuff that gathers in there.
Thank you.
And the problem is, once you have a pilonidal cyst, we were just talking with Jody, who's had it since puberty. You have that unless you do something more significant, right?
There are many authorities who believe that pilonidal disease, after perhaps 10 years or so, can oftentimes burn itself out. Of course, there are people like Jody who, unfortunately, this is a chronic problem that can go on for many, many years. Some of the conservative things that people can do to manage the disease is try and keep the area free of hair. Hygiene also plays an important role. But if it doesn't improve, then oftentimes surgery becomes an option that people must pursue.
So, take-home point, and Jody, sounds like something you've been very cognizant of, steps that you need to take in your daily life to keep your little buddy sleeping.
Yes, that's right.
So, we want to thank you for sharing your story and helping to explain, along with Dr. Madsen, to everyone what a pilonidal cyst is. We appreciate it. Thank you both.